Wondering if prednisone can help with cluster headaches? Hi, I'm Dr. Megan, your prednisone pharmacist, and I'm here to tell you all about cluster headaches being treated with prednisone. This was triggered by a question from a person who said, "Greetings, I'm a cluster headache sufferer and would love a video on prednisone use and cluster headaches. I've been on 20 milligrams 5 times for 4 days, 20 milligrams 4 times for 3 days, 3 times for 3 days, 1 time for 3 days. Never had this high of a dose. I'd love to see your research on this." All right. So if you have the horrible symptoms that are associated with cluster headaches, then you know that you'll basically do anything to make it go away, right? Cluster headaches are so miserable. And so having a treatment like prednisone that can help is miraculous, and people find it very helpful. The only problem is that prednisone comes with a host of side effects, which we will talk about later. So let's talk about cluster headaches. Cluster headaches are a different kind of headache than your typical migraine, and they typically last longer. So to abort that, we don't normally use prednisone, but as a preventive treatment is when prednisone is usually an option. And what will often happen is when a person's diagnosed with cluster headaches, then the doctor may prescribe 2 medications. They've shown that 2 is usually better than 1 super high dose one. And often it will be verapamil, which is actually a blood pressure or heart rate medication, along with prednisone. And they did a study comparing verapamil with prednisone or a placebo. And what they did is they started at a low dose of verapamil and slowly increased the dose of verapamil. And then they did the opposite with the prednisone. They started a high dose and slowly decreased over time. Essentially, the point was that the verapamil takes a while to kick in to help out with the headaches, whereas the prednisone works rapidly to help with the headache. So the idea is to give coverage until the verapamil is fully in place and to minimize as many side effects as possible. So when they did this, comparing whether the prednisone or the placebo worked better, they found that giving prednisone in almost the exact dose that this person asked was much more likely to provide benefit, with an average of negative 2.4 headaches associated with the prednisone group compared to the placebo group. So it helped prevent 2.5 headaches, essentially, as opposed to not using prednisone. So that's why most doctors will prescribe prednisone along with verapamil to prevent headaches. And usually the goal is to get off of prednisone once the verapamil is in place. And that's because of the side effects. So let's talk about what the side effects are. Those include weight gain. Now, this can be dramatic weight gain. Some people will gain as many as 60 or 70 pounds over several months of treatment. It's on average is a 10% body weight gain. There's osteoporosis, long-term bone loss leading to fractures, lost height, and potential joint replacements. Number 3 is mood changes, such as depression, psychosis, and other miserable side effects. Insomnia can be quite intolerable, especially at the high doses required for people with cluster headaches. A high dose is generally considered to be anything above 20 milligrams, and usually people with cluster headaches need 30 milligrams or more, and the typical starting dose is 100 milligrams. That's huge. I'm saying that is huge because prednisone is mimicking a hormone your body normally makes called cortisol. And your body's normal amount of cortisol that it's making per day is the equivalent of approximately 2.5 milligrams of prednisone. So when you take 100 milligrams, that is way more than your body is used to. That's why you're getting so many side effects. There are up to 150 total side effects that I could mention, but those are the most important and commonly experienced ones. Then there are some people who, once they start taking prednisone, they can't stop taking it because the headaches come back. And that is so hard because finding the balance between having the horrible cluster headaches or the horrible prednisone side effects, it's a really tough balance to find. So work closely with your doctor to see if there are any other possible medications they could start to prevent headaches aside from prednisone. Because while I agree that cluster headaches are worse than most prednisone side effects, prednisone's side effects are worse than any other drugs. So doing whatever you can to minimize your exposure to this drug over time would be a really good goal. If you're wondering about any other side effects and what you can do to minimize them or even counteract them, I have a prednisone checklist, and it includes the top things that you can do to counteract side effects in a step-by-step manner. And you can get it by just clicking the link below to download it now. Signing off is Dr. Megan, your prednisone pharmacist.